Rehabilitation of rheumatic diseases is crucial for improving the quality of life of patients by reducing pain, improving mobility, and increasing independence. A comprehensive rehabilitation program usually includes the following components. 1. Physical therapy, techniques to strengthen muscles around affected joints and improve flexibility. Specific exercises aimed at improving endurance and reducing pain. Electrical stimulation to reduce pain and enhance circulation. 2. Occupational therapy, training patients to perform daily activities in ways that minimize stress on joints, providing assistive devices such as splints or adaptive tools. 3. Pharmacologic management, enhancing medication adherence to reduce disease activity and achieve better therapeutic responses, educating patients on the importance of following prescribed medication regimens. 4. Psychological support, offering psychological support to help patients cope with chronic pain, counseling to reduce stress and anxiety related to rheumatic conditions. 5. Nutrition, promoting nutritional strategies that reduce inflammation and support bone health, encouraging weight loss when needed to decrease joint stress. 6. Patient education, teaching patients the importance of participating in rehabilitation programs, which address not just physical health but also psychological and social aspects. Rehabilitation for rheumatic diseases requires a multidisciplinary approach to ensure the best possible outcomes for patients. Therapeutic exercises play a vital role in the management and rehabilitation of rheumatic diseases. They are designed to improve the overall physical function, reduce pain, and enhance the quality of life for patients. Here are the key roles of therapeutic exercises in rheumatic disease management. 1. Pain reduction. Regular, low impact exercises help reduce pain by increasing blood flow to the affected joints and reducing stiffness. Strengthening the muscles around the joints provides support, reducing the load on the joints and decreasing pain. 2. Improving joint mobility and flexibility. Stretching and range of motion exercises help maintain or improve joint flexibility, which is often compromised in conditions like rheumatoid arthritis and ankylosing spondylitis. These exercises can prevent contractures and help patients retain their ability to perform daily activities. Muscle strengthening. Strengthening exercises target specific muscle groups to support weakened joints, improving stability and reducing the risk of further joint damage. They also help in maintaining muscle mass, which is important since muscle wasting, sarcopenia, can occur in chronic inflammatory conditions. 4. Enhancing cardiovascular fitness. Aerobic exercises such as walking, swimming, or cycling improve cardiovascular health, which is particularly important for rheumatic patients at higher risk of cardiovascular disease. Regular aerobic activity also helps with overall energy levels and reduces fatigue, a common symptom in many rheumatic diseases. 5. Weight management. Therapeutic exercises combined with a proper diet help in maintaining a healthy weight. Reducing body weight decreases stress on weight bearing joints like hips and knees, which is crucial in conditions like osteoarthritis. 6. Psychological benefits. Exercise has been shown to improve mental health by reducing symptoms of depression and anxiety that are common in patients with chronic rheumatic diseases. Physical activity releases endorphins, which contribute to an improved sense of well being. 7. Preventing deformities and disability. Therapeutic exercises can help prevent joint deformities by maintaining joint alignment and reducing the progression of joint damage. Regular exercise preserves the ability to perform daily tasks, thus preventing disability. 8. Reducing fatigue. While it may seem counterintuitive, regular exercise can actually help reduce fatigue in rheumatic patients by increasing overall endurance and improving sleep quality. 9. Promoting healing and recovery. For patients recovering from surgery, such as joint replacements, therapeutic exercises are critical for restoring function and facilitating the healing process. In summary, therapeutic exercises are a cornerstone of rheumatic disease management. A well-designed exercise program, individualized to the patient's condition, plays a crucial role in both short-term relief and long-term management of rheumatic diseases. Functional assessment scores are essential in evaluating the impact of rheumatic diseases on a patient's ability to perform daily activities and to monitor disease progression and treatment effectiveness. Several standardized tools are commonly used to assess functional status in patients with rheumatic diseases. Here are some of the most widely used functional assessment scores. 1. Health Assessment Questionnaire, HAG. Purpose. The HAQ is one of the most widely used tools for assessing functional ability in patients with rheumatic diseases, especially rheumatoid arthritis, RA. Components. The HAQ evaluates 20 activities across 8 domains: dressing, arising, eating, walking, hygiene, reach, grip, and other daily activities. Scoring. Patients rate their difficulty in performing these activities on a scale of 0, no difficulty, to 3, unable to do. The total score ranges from 0 to 3, with higher scores indicating greater disability. HAP 2. Modified Health Assessment Questionnaire, MSHQ. Purpose. A simplified version of the HAQ that focuses on 8 key activities. Components. The MSHQ assesses the same domains as the HAQ but with fewer questions, making it quicker to administer. Scoring. Similar to the HAQ, the MSHQ uses a scale of 0 to 3 with higher scores indicating worse functional ability. TAR 3. Stanford Health Assessment Questionnaire Disability Index, TAQ-DI. Purpose. A more detailed version of the HAQ widely used in clinical trials and research. Components. This index includes additional questions on the use of assistive devices and other support measures, such as help from another person. Scoring. The HAQ-DI score also ranges from 0 to 3, where a higher score indicates greater disability. 4. Bath Ankylosing Spondylitis Functional Index. Purpose, specifically designed for patients with ankylosing spondylitis, AS. Components, consists of 10 questions evaluating the patient's ability to perform basic daily activities and more complex tasks. Scoring, patients rate their ability to perform each task on a 0 to 10 scale, with the final score being an average of the 10 ratings. A higher score indicates worse functional impairment. Header 5. WOMAC, Western Ontario and McMaster University's Osteoarthritis Index. Purpose, used primarily to assess patients with osteoarthritis of the hip and knee. Components. The WOMAC index evaluates pain, stiffness, and physical function through 24 items. Scoring. Scores for each section are calculated separately, with higher scores indicating worse symptoms or greater functional limitations. Cover. 6. Rapid 3, Routine Assessment of Patient Index Data 3. Purpose, a simplified tool to assess disease activity and function, particularly in rheumatoid arthritis. Components. Rapid 3 includes 3 domains: physical function, based on MHA, patient global assessment, and pain. Scoring. The score ranges from 0 to 30, with higher scores reflecting higher disease activity and worse function. TAR 7, Scleroderma Health Assessment Questionnaire, SHAKE. Purpose, an adaptation of the HAQ for patients with systemic sclerosis, scleroderma. Components. In addition to the standard HAQ questions, the SHAQ includes visual analog scales, VS, to assess specific symptoms of scleroderma such as Raynaud's phenomenon, digital ulcers, and gastrointestinal involvement. Scoring. The HAQ component is scored as in the original, with additional scores for symptom-specific, VS. TAR 8. Functional Assessment of Chronic Illness Therapy, FACIT. Purpose, used to assess fatigue, which is a common symptom in many rheumatic diseases. Components. FACIT fatigue is a 13-item questionnaire that measures fatigue's impact on daily activities and function. Scoring. Each item is scored from 0, not at all, to 4, very much, with lower scores indicating worse fatigue. 9. The Arthritis Impact Measurement Scales, AMOS-2. Purpose, measures the impact of arthritis on physical, emotional, and social well-being. Components. AMOS-2 includes 78 items that assess physical, emotional, and social domains, as well as symptoms like pain and fatigue. Scoring. The score is divided into different sections, with higher scores indicating greater impact and worse function. These assessment tools provide a comprehensive evaluation of how rheumatic diseases affect a patient's daily life, helping guide treatment decisions and monitor progress over time. The choice of the tool depends on the specific rheumatic disease being treated and the goals of the assessment. Assistive devices are essential for helping patients with deformities due to rheumatic diseases maintain independence, reduce joint stress, and improve their quality of life. These devices are designed to support weakened joints, compensate for lost function, and facilitate daily activities. Below are some common categories of assistive devices used by patients with rheumatic disease-related deformities. 1. Mobility aids. Canes and walking sticks provide support and help balance for patients with lower limb deformities or weakness. Adjustable canes can help reduce strain on painful joints. Walkers and rollators offer more stability than canes and are particularly useful for patients with severe joint deformities or those who require greater support while walking. Crutches help offload weight from affected joints, particularly in cases of severe lower limb deformities. Wheelchairs and scooters for patients with advanced deformities or significant mobility impairments. These devices allow for greater independence and mobility over longer distances. Orthotic devices, splints and braces. Custom-made or prefabricated splints and braces can stabilize deformed joints, prevent further deformity, and reduce pain. For example, wrist splints for rheumatoid arthritis help support the wrist and reduce strain on inflamed joints. Orthotic insoles. Custom insoles can help correct foot deformities caused by conditions like rheumatoid arthritis or lupus, reducing pain and improving walking function. Knee braces provide support and alignment for patients with knee deformities, particularly in osteoarthritis. 3. Hand and finger assistive devices. Ergonomic handles. Patients with hand deformities or grip issues can benefit from devices with enlarged or ergonomically shaped handles, such as utensils, pens, and grooming tools. Jar openers and button hooks. These tools assist patients with limited grip strength or hand deformities in performing tasks that require fine motor skills. Finger splints. These splints help maintain finger alignment and reduce pain for patients with conditions like rheumatoid arthritis or scleroderma that affect the fingers. Haberhashna 4. Daily living aids. Reachers grabbers extend the patient's reach, allowing them to pick up objects or reach items on high shelves without putting strain on deformed joints. Shower chairs and grab bars, installed in the bathroom to provide support for patients with lower limb or spine deformities, helping them safely maintain hygiene and reduce the risk of falls. Raised toilet seats and toilet frames assist patients with hip or knee deformities, reducing the need to bend excessively while sitting or standing. Dressing aids. Tools like sock aids, zipper pulls, and long-handled shoehorns help patients dress independently, especially if they have deformities in the hands, shoulders, or hips. 5. Assistive devices for eating. Built-up utensils. Eating utensils with enlarged handles are easier to grip for patients with hand deformities or reduced hand strength. Plate guards and non-slip mats help patients with limited hand control or hand deformities to eat independently without spilling food. Adaptive cups and mugs, mugs with two handles or weighted bases, help patients with hand tremors or deformities drink without spilling. 6. Communication and technology aids. Voice-activated devices, smartphones, tablets, and home assistants that can be controlled via voice commands are helpful for patients with severe hand deformities or limited upper limb function. Adaptive keyboards and mouse devices. Ergonomically designed computer accessories, such as keyboards with larger keys or specialized mouse devices, assist patients with hand and wrist deformities in using technology more comfortably. 7. Adaptive footwear. Custom-made shoes. Specially designed shoes can accommodate foot deformities, reduce pressure on sensitive areas, and improve walking comfort. Elastic laces and Velcro fasteners. These help patients with limited hand function or deformities fasten shoes more easily than traditional laces. 8. Joint protection aids, energy conserving tools. These tools reduce the effort required to perform tasks, protecting deformed joints from further stress. For example, electric can openers or power toothbrushes. Anti-vibration gloves, useful for patients with hand deformities or joint issues who perform activities that involve repetitive motions. These gloves can reduce the impact on the joints. 9. Adaptive beds and chairs. Lift chairs, recliners that can lift and tilt forward to help patients with hip, knee, or spine deformities stand up more easily. Adjustable beds allow patients to raise and lower the head or foot of the bed, which can help reduce joint pain and improve comfort, especially in those with spinal deformities. 10. Assistive devices for cooking and household tasks. Electric kitchen gadgets. Devices like electric can openers, food processors, and jar openers help reduce strain on deformed or painful joints during cooking. Long-handled cleaning tools. Mops, brooms, and dustpans with extended handles minimize the need to bend or stretch, which can be difficult for patients with joint deformities. These assistive devices are crucial in helping patients with rheumatic disease-related deformities remain independent and manage their daily lives more effectively. The selection of appropriate devices should be individualized based on the specific needs and limitations of each patient.